Once again, hello everyone. I'm very, very happy to be here in the first IHIN hour of 2024. Hopefully I will start with my presentation regarding what we do at the SORMAS Foundation, because we work more at the global level, and then Koshal will present the work that the team in Nepal is doing. I will start with a brief introduction of what is SORMAS, because I'm not quite sure if everyone is familiar with SORMAS, and then I will go and explain more in detail what we do at the SORMAS Foundation. So first of all, I would like to, I will focus on what is SORMAS. So SORMAS, for the ones that don't know, it's the name SORMAS, it's an acronym, and it means surveillance, outbreak response, management, and analysis systems. And I always like to start with this, explaining what is the acronym, because if you know what the acronym means, then you will know already a lot what is SORMAS, because SORMAS is not only a surveillance system, but it's also an outbreak response, management, and analysis system. So it means it's not a system that collects data, but it collects data to promote action. In this case, the response to outbreaks. So the way SORMAS manages epidemics and pandemics is it's clear. SORMAS is a platform. It has different users, and all the users enter the information on the same SORMAS platform. The information is entered and can be seen in real time by other users, obviously with the access restrictions that apply. And then this helps during the 3 steps of the epidemic control, detection, investigation, and control, for all the actors that are involved to receive the information, to enter the information at their points, but also to receive the information they need to act. Everything is entered into the SORMAS platform, and also, very importantly, people receive information they need. So the system it's not only a system that allows just entering information, but everyone can access information. So here's how the SORMAS dashboard looks like. You see there is some geo-coordinates. You can see epi curves and the summaries for the different diseases. So that's just very much in a nutshell some of the technical features of SORMAS. SORMAS can be used on a desktop or mobile. It can be used online and offline. As I mentioned before, it allows the multi-directional data sharing, not only bottom-up or top-down, but multi-directional between different users. And it's real time. And this is obviously very important when it comes to controlling outbreaks. As I mentioned before as well, the system has a user-specific access. It means that depending on where you are, if you're at the district level, you're a district worker, then you will be able to see the information at the district level. If you work at the national level, you will be able to see the information at the national level. It has also a task management system internal to facilitate the coordination of teams in the response to outbreaks. The system is available in several languages. I think we have over 20 languages at the moment. It is interoperable with other systems as well. It allows indicator and event-based surveillance, and it is based on the IDSR. The data protection and security concept in SORMAS is very comprehensive, and this is partially because it has been implemented and used in European countries, and this has made our concept, the SORMAS concept for security and then data protection, to develop very much. SORMAS has a modular structure with over 40 disease modules at the moment. And finally, it allows cross-border coordination and visualization of transmission chains. So I will not go more into detail on what is the tool itself, because you can go yourselves to the website or the website. You will see there is a demo version. You can enter into the demo version, and then you can play around with the tool freely. So SORMAS is a DPG and a mature global good. So for the ones that are not very familiar, digital public goods is a definition by the United Nations, and it focuses in some criteria, which include open source, adherence to private and other applicable laws, best practices, do no harm, and help attain the SDGs. In the case of SORMAS, SORMAS obviously helps directly to attain the SDG number 3, which is related to good health. So SORMAS is also a mature digital health software global good, which follows other criteria. The definition is by Digital Square. Digital global goods are free and open source, are supported by a strong community, have a clear governance structure, they are funded by multiple sources, they are deployed at significant scale, used across multiple countries, have demonstrated effectiveness, and they are interoperable. As you see, the definitions, the criteria, a bit, some of them are same, but some others are different. So if you are interested in learning more about DPGs and global goods, you can check the Digital Public Health Alliance website. There is a registry. Obviously, SORMAS is there and many other DPGs as well. As for the global goods, you can check the Global Goods Guidebook from Digital Square. I've left you the links here in case you want to check them. So SORMAS has been used or is being used in several countries across different continents, over 10 countries at the moment, and probably more because it's open source. So sometimes we find out of countries that are using SORMAS without us knowing it. For the moment, we know that there are over 300 million people that are protected through the system. Over 10,000 health workers have been trained on SORMAS, and SORMAS has been used in hundreds of, for the control of hundreds of outbreaks worldwide, and obviously also for the COVID-19 pandemic. But what is the SORMAS Foundation? What do we do? Why is it important to have the SORMAS Foundation? So just as a brief timeline, to provide you a bit of background, the SORMAS idea and prototype started in 2015 as a collaboration between the Nigeria Center for Disease Control and a research center in Germany, the Helmholtz Center for Infection Research. It very soon moved into open source right at the beginning, the following year. And the pilots in Nigeria started 2017, followed by pilots in Ghana as well. The SORMAS, the software started with 7 diseases, but very quickly included other modules and also the laboratory module, which is also available in the system. In 2019, the software continued expansion, and very importantly, it was recognized, as I mentioned before, as a global goods. The maturity assessment for global goods was done and recognized SORMAS as a global good. And as you can imagine as well, with the onset of pandemic COVID-19, the demand for SORMAS very quickly increased. So there was also a very fast development of the COVID-19 module and the expansion, geographical expansion into new countries, including in Europe. 2021, also middle of the pandemic, the geographic expansion continued. I think it was about that time that Nepal started piloting SORMAS. And also, as I mentioned before, the data protection concept was very, very much developed. Finally, in 2022, the SORMAS Foundation was established. And as you can see, like the project started as a research project and very, very quickly moved from the research project into an implementation project with requests from several countries for support. So it was very clear back at that time that it was not possible to have such a project in a research institution. That's why the nonprofit SORMAS Foundation was established in 2022 with the goal of supporting countries and making sure that the software has good quality and is sustainable. So the SORMAS Foundation has a vision, and this vision is a world in which all countries are prepared to respond to epidemics and pandemics digitally and collaboratively. So we highlight the digitally and the collaboratively because it's really the essence of what we do. Our mission, obviously, we do so through building a strong community, through the development, promotion, and implementation of open source digital systems that support national and international organizations in early detection and containment of epidemics and pandemics. So you see also a highlight on the building of a strong community. So basically, the SORMAS Foundation doesn't want to be at the center of the ecosystem, but to support the ecosystem, the community. And this big community has different actors. It has implementers, funders, IT companies, researchers, users, etc., etc. So the areas of work of the SORMAS Foundation are 4. The first one is the software curation. What we do is here we make sure that the contributions from the different countries are not done in parallel. So we don't want to have countries working on the same development at the same time and making efforts in parallel. We try to join efforts and make sure that there is some coordination. So we do this coordination based on the requests and the developments of the community. We make sure that there is a roadmap for development. So we have another area for training and accreditation. This is training of the users. We usually do training of trainers and also accreditations of IT server providers. The fourth area of work is the implementation support to countries. We do so, I'll explain in a couple of slides. We do so by doing a needs assessment, understanding what the countries need, how can SORMAS be an added value for these countries, and then helping with the configuration of the system and follow up. And then finally, we have the community building, where we try to promote the exchange of the different actors of the community. We do so by organizing several activities like webinars. We also organize webinars. We organized our first SORMAS conference last year, where our colleagues from Nepal attended. We do online meetings. We have a community platform, etc., etc. So, but how do we work with countries? So the first step is when a country is interested in SORMAS, usually gets in touch with the SORMAS Foundation. I mean, sometimes they get in touch through, we get the connections through implementers, for example, that want to help some countries. But usually these are very rough steps. Countries get in touch with the SORMAS Foundation, countries or organizations, of course. Get in touch with the SORMAS Foundation. We help, as I said, with the needs assessment to try to understand how SORMAS can fit into the health system and how can it be adapted. Because I didn't mention that before, but SORMAS can be used at the national level, at the regional level, for one disease, for all diseases, etc., etc. After that, we prepare an implementation plan where we try to always add a budget. And the budget issue, it's important because sometimes, or most of the times, people are not, do not know exactly what are the costs of the implementation of a digital tool. So we try to, from the very beginning, inform of what is needed. It is server, the team, etc., etc. Or the tools or the hardware, for example. So after this implementation plan has been done, then we help countries and organizations with the configuration of the system. This is done together with the team in the country. Then we usually do training of trainers. So we embrace the training of trainers, a cascade strategy for the sustainability. So we always start with the training of trainers, and then usually we support the trainers that have been trained into their first trainings to the users so that the cascade can follow smoothly. Then after that, countries start using the tool. Then we follow up for the first months because it's usually when there are some questions until everything is clear and the countries are independent from our support. And then finally, we encourage everyone to be part of the SORMAS global community. As I mentioned before, we want to have joint efforts and not parallel efforts. And for that, when countries are using SORMAS, we invite them to participate in our community activities to make sure that everyone can benefit from the work that is being done in each country. So plan activities, that's my last slide. So the plan activities for the coming months. On the area of software curation, we are working on the development of SORMAS 2.0. That should include some enhancements in the system. We'll continue, of course, doing the curation of the software, exchanging with the different actors, developers, getting feedback from them. In the area of the training and accreditation, we will develop and will establish very soon the SORMAS Academy. You will see that soon. Hopefully, where we aim not only at providing trainings in presence-based trainings, but also to have online trainings to facilitate people who are interested in SORMAS to get all the information easily online. On the area of support, we're working on a regional SORMAS concept that we aim at piloting in West Africa and the ECOWAS region, so that regional organizations such as the Regional Center for Surveillance and Disease Control can also use SORMAS and can get the information they need from the different countries at the regional level, and therefore take action or do recommendations, which is usually the role of regional organizations. Finally, in the community building, we will continue fostering the exchange of the SORMAS community with different events, different webinars. We have already planned our webinars for the coming 6 months. We also planned, if everything goes well, to have another SORMAS conference this year. And everything to reach our impact, which is protect more people from epidemics and pandemics in different countries and continents. So that's it. That's the end of my presentation. I will leave you with some links, and then I will hand over back to Cha to introduce Koshal, that will present the experience in Nepal. Thank you very much.
Now we would like to proceed to the next presentation. May we call on Sir Koshal?
So, hi, good afternoon, everyone, and good evening there in Manila. Sorry, I apologize. Like I am joining this this webinar in between my travel to Mugu, a very remote areas of Nepal, for the influenza investigation, and then I stopped by a police beat. Small police beat, and they became very nice to me, and I'm just doing a presentation from here. So I just would like to request you that my internet connection, that I have been joining through my mobile phone, that may have some disturbances. So sorry for that. And so I would like to thank you again for these your opportunities, and I would like to start my presentation. Yeah, so like regarding the SORMAS, this is the map of Nepal that we have been implementing SORMAS in 2 provinces of Nepal, as you can see in Gandaki and Sudar Paschim, among the 7 provinces. Before I go to the SORMAS, then what I would like to show is the health system of Nepal. Actually, since a few years we have moved to the federal structure, and there are 3 tiers of government: federal, provincial, and the local level government. They have been, have a responsibility in different areas of health. And infectious disease control jurisdiction falls under the central government mainly, but with advanced coordination with the federal and the local level. And then regarding the infectious disease surveillance in Nepal, that this infectious disease surveillance is in a fragmented ways, vertically have been conducted by different institutions. For example, the Epidemiology and Disease Control Division under Department of Health Services, where I work, it it has a system of early warning and reporting system, a national surveillance tool that has been implemented since 25 years, and that makes a surveillance of 2 syndromes and 4 specific diseases that are epidemic prone and are in a line of national elimination. Before that, some other diseases are also be are under surveillance through the US system. And another is that the family welfare division that do the surveillance of immunization preventable diseases like polio, rubella, congenital rubella, JE, neonatal tetanus, and all these things. And other important part of the surveillance that have been functioning in Nepal is the laboratory surveillance, mainly done by the National Public Health Laboratory and its organization in the provinces of respiratory syncytial virus and influenza, COVID-19, and antimicrobial resistance through some places. So, we have a rapid response team framework that the guidelines that we have developed, the EDCD developed some years ago. This is the main framework, how we work, how we respond to any outbreaks or emergency after the data that we receive from the surveillance in the federal level, provincial level, and the local level. We have both RRT committee that usually takes task of facilitation, and the main working committee to respond the outbreak is the rapid response team. And there are all the 3 tiers of government has that team, and mainly the local RRT is the first one who responds for the outbreaks or any epidemics and the pandemics. And to coordinate between the provincial and the local levels, district RRT committee is there just to make a joint connection in between those governments. The surveillance system framework in Nepal, this is the framework for the surveillance and response system in Nepal. That the main places, main areas that we receive the informations on informations are divided into 4 categories actually: the event-based surveillance and the indicator-based surveillance. Event-based surveillance is practiced, but indicator-based surveillance is practiced like from the US and the other hospital registered data. But event-based surveillance that we have been trying it and implementing SORMAS that will look after more on the event-based surveillance. It will also look on the indicator-based, but we are applying it as an event-based surveillance tool. And through that information, when getting the signal, they are entered in the digital platform, and then the trials verification and the risk categorization and assessment is done, and then the response is done. So these all this trials verification, risk assessment, and categorization, and then the response are done mainly primarily by the local level rapid response team. So as we can see in the figure that the rapid response team in the local level, where they receive the signals and the events, they are the one who verify it and the response at first. And the provincial and the federal level, they provide more technical support, guidelines, and investigation if they are asked to do so. So the primary responders are the rapid response teams at local level. And the current EVAR system that we have been having some gap in this EVAR system that make us to implement the SORMAS for the event-based surveillance. We actually the EVARs are the hospital-based sentinel site surveillance, and then the data are we acquire the data from the hospitals, and then then it goes to the EVAR system, and the data that we receive already they will be in a late we analyze it after one week actually. So this has been the gap of analyzing data too quickly and getting the early alerts in the US system. So the component for event-based surveillance is now practiced from the SORMAS. So the SORMAS information flow hierarchy in Nepal, as you can see in the figure that all the 3 levels of government are included in this information flow network. Mainly, as I told already, that this information related to the outbreaks or the alerts are mainly kept at the municipal level through the points of entries, designated points of entry that we have here in Nepal, like 12 designated points of entry throughout the country. Even hospitals, the health post and primary healthcare centers, the basic level health service providing facilities, and then the laboratories that have been in the community level or in the district level. And then in the provinces, they are mainly responsible for the data cleaning, analysis, interpretation, and giving feedbacks, and the RRT mobilization if needed. And in the central level, federal level, we have the main database on the EDCD under the Department of Health Services, and for the lab surveillance, we have a National Public Health Laboratory, and then we do the formal analysis and interpretation of data that we receive through the SORMAS. And as I showed in the earlier slide, that we also support for the rapid response teams and for the investigations and providing the feedbacks. The SORMAS architecture in Nepal, like the information, we can see in the red, that's the emergency community that are now missed actually. So we are trying to receive it through the SORMAS. And then hospital sites, we have a system like EWAS that we receive the information from the hospitals, sentinel sites, and laboratories also. We have been receiving some information, but not all. And then all this information, either through the call center or the health workers that use the SOMAS tool, or the hospital or EWAS site, they all report in the ADCD database, and the information is flowed to the health focal person on the province and the local level. So this is the architecture, SOMAS architecture that we have been using. And when I come to the progress regarding the SOMAS in Nepal. Actually, the SOMAS or the SOMAS is one component of KORESMA project. It's on Horizon 2020 project. Actually, it's a joint project written by Ministry of Health and Population along with the World Health Organization Nepal, Swiss TPS, Helmut Center for Infection Research, and other organizations. And then we couldn't use it on time before during the early phase of COVID-19 due to very some kind of administrative and other problems. But in April 2022 we had a training especially for the district level managers, actually district level focal persons, in the use of SOMAS tool actually. And then in the November 22, we provided the training to some of the selected municipalities in the Sudur Pasim provinces and the point of entry staffs to use the SOMAS tool and enter the data in the SOMAS. And then from the May 2023, actually, we started training on a massive scale, that we trained all the health workers, rapid response team members, and health coordinators of each local levels, along with the focal persons and managers of province health directorate and line ministries, and we trained more than 200 people there. And in the June 2023, then we had a next training on the Sudur Pasim province, and we also trained 200 plus health workers from 93 municipalities, whole municipalities in that Sudur Pasim provinces. And then now the data have been entering in the SOMAS. Until now, more than 22,000 data has been entered in the SOMAS system, and we are analyzing it. And we have also been, registering the public health importance events, like the SAFU that we have last time, and other public health important events in the SOMAS tool. And as I have to tell that SOMAS in Nepal is being implemented as a pilot program through this KORESMA project. And now the project time has been ended, and we are planning to implement it, scale up it in the other provinces rather than beside those two provinces actually. And what we have been linking, the Ministry of Health and Population, Department of Health Services, Epidemiology and Disease Control Division, we recently had listed some prioritized diseases, notified diseases for Nepal, infectious diseases, as per the Public Health Service Act, that has given us mandate to make a list of these infectious diseases and prioritize them. And then we have just finished it, and it's on the proper process to get published on the Gazette. What we have, prioritized 52 diseases, and we are thinking, we are making our SORMAS tool customize and include all these 52 diseases in the SORMAS tool, so that we can cover almost all diseases of public health importance, or disease for the surveillance. We can incorporate it in the SORMAS tool. So we are working on that. And SORMAS, regarding the progress in Nepal, like the government budget and implementation component, we have a very strong commitment from the Gandaki province, political commitment, like the health minister level commitment. They had, we got it in the Gandaki provinces, and it is scaled up in the Gandaki provinces up to the private hospitals also. So recently we trained for some private hospitals and laboratory personnel in the SOMAS last month. And then, like the KORESMA project had funded SOMAS for 2 years, and nationally prioritized diseases are to be integrated on the SOMAS, as I already told. And then to scale up in other provinces, we have managed some budget actually. We have planned it, the support of World Health Organizations and the pandemic funds that we have been received. We are trying to scale up it in the other provinces. And then the epidemiological laboratory surveillance had been started using the SORMAS platform between the EDCD and the National Public Health Laboratory, and also in the provinces, those two epidemiological surveillance and the laboratory surveillance. And then regarding this SORMAS customization and development, we have added 12 more digits in the SORMAS till now. That the original SORMAS tool that we have added 12 digits, and we have started doing the surveillance on those 12 digits. And another thing, as I told already earlier, that we are using it as a tool for the event-based notification for the disease surveillance. So for verification of any signals and making it a true events, that we have added news tab in the SORMAS, even in the tablet form, so that the RRT members, they can scroll their tablets in a day and they can see whether those kinds of news are being published in their region. That signifies possibility of an outbreak. So we have done this with the help of the epidemic intelligence from open sources program, with the technical support from the World Health Organization, and that have been really helpful to verify those signals that have worked as a one component to verify those signals that to be done true event actually. And then we have we have added the downloading tablets in the SORMAS version, so that the people can download it. The new user can download the software and install in this in their mobile phone and use the software. And then we have been regularly using the upgraded version of the software. That's the things. These are the main things that we have been doing for the SORMAS customization and the development. And of course, we have very, very, very that challenges. Actually we couldn't do anything for more than 2.5 years, I say. So the administrative challenges that we faced, and the being a new program and a pilot program, we have to make the policy labels, decision makers, make them understand the importance of SORMAS. And we don't have any data before we implement, and we cannot show them. This has made this kind of significant change and the progress. So that was the problem that we faced for 2 years, the administrative and financial processes for the decision. And then the main thing that we have been using, the health workers in our country, they have been using DHS2. Almost every health facilities had more than 10,000 facilities have been using DHS2, and they are asking for demand to interoperate these two softwares so that they can use a single tool for the disease surveillance purpose as well as for the other purposes. And then we have some budget actually, but we still lack the funds for the scaling up to the whole other five provinces up to the national level. So the funding is also another challenges. And then the newly introduced this federal system, and the working jurisdiction of 3 tiers of government has also been some kind of challenges. And then aligning the SORMAS with an existing surveillance system is also challenges. Maybe the interoperability capacity can solve this, and I hope this University of Oslo and the SORMAS Foundation, they have been working on this Charisma DHS project, and that we will get it the result very soon, and we can just implement it. And the way forward, we have been thinking this SORMAS as a possibility of tool for the integrated disease surveillance, which is a very the long-term vision of Department of Health Services, that we have been facing problem of not having the integrated disease surveillance system. So this could be the standalone tool for the IDS as for now, for the strong event-based surveillance system. And then scaling of the SORMAS to other provinces is also our way forward. And then the regular advocacy and need for the SORMAS is strengthening for the disease surveillance and response system. That also we have to do on a regular basis, just to make them understand to use the new tool especially for the disease surveillance and the outbreak management. And then the infectious disease, always we have been facing this problem in other programs also, just to use the data is entering the data in the new tool after the training. So that is some kind of that we always face when you use the new tool. So For SORMAS also we have been that kind of problem. In Gandaki we have been using it quite smoothly, but in the Sudur Pasim provinces it's on the process, and it has been on it has sort of very good way. So that are also the challenges, and we have to think of that too. And then the preparing environment for the artificial intelligence and machine learning and the disease modeling with the use of this tool. Actually, it is a part of the Coruscant project, and the work package 3 was related to this AI and machine learning and disease modeling. We couldn't do it on that time, but I think we have a possibility of doing this through the use of this SORMAS tool. And then, this is some of the pictures that we had during the training, and the high level, the advocacy with the secretaries from the Ministry of Health and Population, with the joint meeting among the Gandaki and the Central Ministry of Health and Population. These are some figures that we have last time. And I would like to acknowledge, all these institutions and people and AEHI and also and the others who has helped us directly or indirectly to come up to this level, despite of our very very hard times during the COVID, and making the SORMAS up to this level. And thank you for all. And this is the my end of my presentation. Yeah, and I'll be very happy to answer the questions if we have. Thank you.
Yes, thanks again for the presentation, Dr. Pilar and Sir Koshal. We now open the floor for questions. If you have questions, you may type them here in the chat box or in the Q&A box. So we actually have our first 3 questions from the participants. First is from Dr. Sandra, and it reads, Hi, thanks for the presentation. So the question is, are the indicators visible in the demo version of SORMAS?
Yes, yes. I can set the link again in the chat if you wish.
Yes, thank you, Dr. Pilar. Our next question is from Dr. Chaminda. So thank you for the informative presentation. Does SORMAS support FHIR-based interoperability? Example, can an EMR submit data via FHIR APIs to the platform, or do they have to log into SORMAS platform itself for data entry?
Yes, this is possible. It has an API, and it's FHIR compliant, not completely FHIR compliant. This is something that we will address in SORMAS 2.0. But yeah, it is possible to submit information via API from AMR, for example.
Thank you, Dr. Pilar. Sir Koshal, in case you have any other additional information, please feel free to jump in. And then the next question is from Dr. Selvaganasan. What are the new features in SORMAS 2.0 and why SORMAS 2.0?
Yeah, so SORMAS 2.0, the idea is to have an upgrade in the technology stack, to have a full integration of the One Health approach, which needs a different architecture of the system. We will also, as I mentioned just a couple of minutes ago, aim at being fully FHIR compliant. And obviously in this SORMAS 2.0 version, the idea will be to integrate all the best practices and all the learnings that we are gathering through all these years with the SORMAS 1.0.
Yes, thank you, Dr. Pilar. To our participants, if you have any other questions, please feel free to send them here or speak through the microphone. I think Sir Jai also has a question. Please go ahead, Sir Jai.
Thanks, Ja. Thank you, Pilar and Subedee. Like, it was a very comprehensive presentation. It covered almost everything that we have been looking for. And then one of the main objective for AHIN to conduct this interactive webinars is to also understand not only the successes, but also to understand the challenges involved, especially for a nationwide scale up. That's very important for the members to know. It's success, sharing the success is important, but also to know the challenges and how the team was able to overcome that or address that. That is also more important. I think Dr. Subedee already shared some challenges, but my question here is, like, we're talking about the pilot project, right? But then, like, when the pilot has to scale up, like, what kind of challenges that you see, and then how do you actually think those could be overcome? Because ultimately the whole benefit is when the system actually scales up as a national implementation. That's my first question for now. Thank you.
Yeah, as far there was some disturbance in during the talk, and Jay, actually, like we have some more challenges. As I saw that there are some challenges to implement scale up in the national level. One more challenge, one of the challenges, like the using pilot tool, the new tool that's seems a lot challenging with different aspects like acceptance of the users, and then the administrative and the financial challenges, and then the what we have like everyone want to see that if we use this tool, then what have been different, what is had made different than the another tool. So that are the main challenges. And other thing is that the sustainability of these, and then like making them trained, having the review meetings and the trainings in between, and then continuous capacity development of these users, and the staff turnover in the countries like limited resource settings like Nepal. These are the challenges. We can see these challenges in the other tools also, and for SORMAS also we have been these challenges. But as we can make our decision makers or the implementers, if that this tool has filled this gap, especially that we don't have it earlier, and it has made us very easy for especially for the disease surveillance and outbreak purpose, then of course sooner or later it gets implemented in a larger scale, and this is happening in context of Nepal.
Thank you, Subidhi. Very helpful.
Thanks, Sir Koshal and Sir Jai. Actually, we have three more questions from the participants. The first one is from Dr. Carl Kincaid from the USCDC. What lab systems have been integrated or interop to receive lab results?
We are closely working with the laboratory, National Public Health Laboratory, and we using this SORMAS tool. Now we have been jointly working for the influenza and COVID surveillance along with the RSV surveillance actually. So we have started with these three pathogens actually, yeah. And we are using this same tool, that's a SORMAS. And what we can see the results, then we'll decide to include other pathogens and other surveillance also in this SORMAS platform, that the laboratory department and our EDCD, they both will use this tool as a common tool for the surveillance from both departments, both bodies, yeah, actually.
Yeah, thank you, sir. Our next question is from Dr. Malinda. Can you share more about the experience, like using the new SORMA system in Nepal, and what is the feedback from care workers like, and any notable impact examples of the system?
Okay, thank you for the question. Yeah, yeah, I can see Dr. Rabindra over here from the Kathmandu University. Actually, like I told all that this SOMAS was a one component of Charisma project among six, and like we have a work package 4 and a Charisma. It's implementation research, and this work package 1 and 4 that are closely related. And for the implementation research, we are working together with Kathmandu University, and soon after the training to the users, we finished this baseline study regarding this what the SORMAS was for them. What was this helpful for them or not? So we finished this baseline study, and the report has to come yet. So that I think seeing the preliminary results, the users has accepted it, and they have taken it as a very very good tool that could address their problems for the reportings of notified diseases actually. So they have liked it, and they want it to be a tool for the integrated disease surveillance actually. But the report will describe it more when it get published. Yeah. Thank you.
Thank you, Sir Koshal. We have another question from Dr. Chaminda. Do you have any online training on the platform function?
So maybe Dr. Pilar, I think this is the question for you, and we can also make that. But the SOMAS Foundation, I think it is the right authority to do this. Pilar, after you, Pilar.
Yes, thank you. Yeah, so we currently offer presence-based trainings or online-based trainings. But as I mentioned during my presentation, we are now setting up the SORMAS Academy. And in the SORMAS Academy, we plan to offer online self-paced online training. So this is going to happen in the coming month or 2 months, where the SORMAS Academy will be up and running. So yes, this is planned. This is possible now. But the online trainings through the SORMAS Academy will be, in addition to what we do already, then self-paced, which I think that will be facilitate the training for many people.
Yes, thank you, Dr. Pilar. Yes, Sir Jai.
Thanks, Shah. Pilar, this question is for you. You also hinted about the SORMAS event that's going to happen this year. Maybe I think it may be a good idea to also share about it to the participants. So maybe some of them will be interested to participate in that.
Yes, absolutely. So we are still thinking, like brainstorming about it. So I cannot share too many details, but what I can share is that it should be probably around November, towards the end of the year. So November, dates are not decided, but as soon as we have more information, I will share that with you regarding the place and the dates. But what I can share is that obviously, as based on the experience that we had this year, past year in October in Berlin, so we did, I can also share with you the report of the conference. So we had a very good feedback, and one of the best, one of the things that the participants highlighted, that they really appreciate the exchange with other countries. So we're planning this time to make it a bit longer, around 3 days, to allow as much exchange as possible between countries. But yeah, again, so as soon as we have more details, we will absolutely let you know.
To formally close our webinar, I would like to call on our Executive Director again, Sir Jai, to close the session.
Thank you, Cha. Thank you, Dr. Pilar and Subedee. I think we started off with the AHIN hour, the first AHIN hour for the year, on a very bright note. I think your presentations, both of it, was like very comprehensive yet very crisp, and we also are all exactly on time. And this has been a very helpful experience to know about SORMAS, and especially we as a regional network, very interested to know what is happening in terms of implementation, and then the learnings, the challenges, especially happening in a country in our region with whom we have been working closely together, like Nepal. So thank you very much for this opportunity. And then also, and then please feel free to post any other updates regarding SORMAS, any updates, and especially on the community and the academy that you mentioned about, Pillar, on then any case studies or publications that come out of the implementations. Please feel free to post it in our listserv. Also, look forward if there are any further updates. Maybe we can follow up with another webinar later in the year. Until then, I think, yeah, let's close this webinar with thanks to both of you and all the participants who have joined. I think we have begun on a very bright note, and then a lot of very interesting webinars are in the pipeline this month and then the next few months. Please do join us and make this more interactive. Thank you very much.